Hey, Gabriel. Jonathan Beeler here, LPC, licensed professional counselor. Every now and then, every couple of days, I want to do a snippet on a condition for mental health. Kind of discuss the broad spectrum of the condition or whatever someone's struggling with. What's the topic today, Gabriel?
The topic is benzodiazepines.
Okay, that sounds like an interesting one. Go ahead.
What are they?
Benzodiazepines are drugs that were created in the 1950s. And it was called the little white pill, and it was used for housewives that basically, would take these, and they thought they were great. And there is a sense that they are great. They, in the sense that they really stop anxiety in its tracks. It's basically like drinking about 3 beers in a little pill. Benzodiazepines, some examples: Ativan, Xanax, Klonopin, are powerful drugs for anxiety. Calm you down very quickly. If you go to the hospital and someone's in a panic, they give them a Xanax or an Ativan, and it calms them right down. However, used long term, every day and for a long period of time, people become dependent because benzodiazepines affect GABA receptors. And these GABA receptors begin to get used. The body begins to get used to the drug. And so when the body gets used to the drug, they begin to have withdrawal even while taking the same dosage over a period of time. And so what happens, they need to take more and more and more. And you see even today, a lot of people, Hollywood stars, people that are, that die because they're on such a high dosage, and they may mix it with alcohol, which makes it even more toxic and dangerous.
So what are they used for?
They're used for, benzodiazepines are used for panic disorder. They are used for anxiety, insomnia, and some seizure disorders. It can even be used for Tourette's syndrome. And it's very effective, but at the same time, it's very addictive.
So I'm not going to ask the next question because you already said
Okay,
they are addictive.
Yeah.
So how long does it take to be independent?
You mean to be dependent upon benzodiazepines?
Mm-hmm.
Well, here's the thing. Now, if you ask most doctors who learn everything they know from, they get their information they get is from the drug companies, and they will tell you that you can just get off of them with no problem, and you can take them for 3 months and don't worry about getting addicted. But if you do your own research and you look it up and you do your research on the internet or however, you'll find that you can become addicted in three weeks. Sometimes a little more than a month or two. They're dangerous drugs, and the withdrawal of benzodiazepines horrific. You can have seizures. You can die if you stop taking them all at once and you don't taper. You can have this feeling that you're walking on a boat. You can have dizziness. Things like massive gastrointestinal issues, panic. That's ironic. It's the exact same thing that you were prescribed the medicine for. What else? Chest pain, symptoms, high blood pressure, elevated heart rate, insomnia, and this is a very dangerous thing. So it's important to find a doctor who will help you taper this, and they're benzo smart, benzo wise, if that makes sense.
So, what do you recommend for someone going through benzo withdrawal?
Okay, benzodiazepine withdrawal. Someone right now is watching this and they're going through it. I would tell them to be patient with themselves To realize that even though it's a long process and the withdrawal itself can take months or sometimes years and protracted withdrawal, and to realize that God, the Lord Jesus Christ, has a purpose for suffering, even suffering as horrific as benzos. I believe that the person that's struggling with this needs someone, whether it's a counselor or a doctor or both, a medical doctor that can help them get through this, talk to, without prescribing any other medicines. You don't want that. And that's kind of hard to do because not many people are very knowledgeable about benzo withdrawal. But I think the most important thing is Jesus Christ. And, what I do as a therapist, he's in the middle of it. With the fact that he's Lord, he's King. And, it's a very hard thing. I don't know how people could do benzo withdrawal without him. I also think that they need to forgive themselves, give themselves a break, and realize don't beat themselves up. They're going to be probably out of work for a while. They're probably going to struggle with doubts if they did the right thing. There are going to be a lot of things going on. They may want to write a journal. I think that a journal would be great to help them process their feelings, because when you write, you're having to use a couple parts of your brain. It's different than just talking or thinking. You're writing it out and you're thinking through. And also, as you're going through the withdrawal, you can go back and see where you are. Because it's such a slow process, it's important for them to see that they are healing. Does that make sense?
It does.
All right. Any other questions?
I think you answered them all.
Thank you. Well, and this is it for today. Hope you enjoy. Any questions about benzo withdrawal that anyone has, they can message me. I'd be glad to talk with them in a private manner. Thanks. Have a great day.